Welcome everybody to the Zoom training that you have waited for. Guess what? We've been waiting for this too. We put a lot of time, energy, effort into a whole bunch of new materials, new content. You're going to see new things tonight, never shown before. Dr. Kaplan and I are incredibly excited to share it with you and to show it to you. So it's real simple. Present time consciousness, shut off your phone, lock the door, and be in the zone, because we're going to go kind of fast tonight, and we're going to show you some incredible things, and we're going to go right to work. And then what I'm going to do, if it's cool with everybody, is I'm going to share my screen. So let me see if I could share my screen, and then we're going to go right into it tonight. We're so happy to see all of you. And look at Dr. Kaplan and his new swag. Yeah, he's got new stuff going on to celebrate. Yes, the victory of a lifetime. Yes, on his birthday, greatest birthday present ever. So let me do this. Let me see if I can do this. And let's see if I can share my screen. Let's go. All right. Let me see. Can you guys see this? Can you see my screen?
Yes.
Yeah, you can? Yes. Beautiful.
Yes.
Thank you for doing that. You know, sometimes it's a little tricky. So what I'm going to do is I'm going to minimize mine. So there we go. Perfect. 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 All right. You ready? Let's go to work. All right. So you're 100% in the right place. The name of this live Zoom training is the Decompression Nerve. When we say nerve, we're talking about peripheral neuropathy success training for 2026, and we're ready to go to work. The coolest thing about this is so many of you here with us live, right here, right now, we already know, and you've known us for many, many years. This Zoom meeting is being brought to you live by, yeah, you know who, Dr. Eric Kaplan and myself. And if you're curious how long we've been hanging out together, a lot of you know this, some of you don't. I was actually his associate doctor 39 years ago. I know it's hard to believe, right? I've been a chiropractor for 40 years. Hard to believe, right? I was his chiropractor. I was his associate doctor 39 years ago. But as you know, as they say, if a relationship is good, it's going to hang out for a little bit of time. If a relationship is great, it's going to hang out a lot longer. And if a relationship is historic, and many people, many doctors, many chiropractors have called our relationship historic. But guess what? It's also historic for all of you that are part of our inner circle, our world, our universe. We're so happy that you are on here live with us. And we got some cool stuff to show you and to share with you, never seen before. And just a little bookkeeping, just a little disclaimer. And the reason we put this slide in there is really, really simple. You're going to see protocols. You're going to see tools. You're going to see graphics. You're going to see materials and content that you're going to say, oh, gee, I need to do that. Well, guess what? You're the doctor. You make the decisions. Dr. Kaplan often says, who's the CEO of your business? So obviously, everything we want you to take from this, we want you to obviously do the diligence and research. But guess what? We've done most of that for you anyway, but I just wanted to make you conscious of that and to always put your patients first, no matter what, above all. Yes, even above this. We'll talk about this tonight, though, too. But your patients always, always come first. Many of you know us, some of you don't. But for those who don't, have been hiding under a rock for all these years. Yes, it's Dr. Kaplan and myself for all these years that, believe it or not, we actually created this incredible thing. Oh, I'm sorry. I think I just muted you by mistake. And that's what happens when you get like button happy. I'm going to take that off. I'm going to unmute you, or you can unmute yourself. There you go. Unmute yourself, Dr. K. That would be great. We're the creators of, as you know, the most powerful, most popular, most rooted brands in the history of the chiropractic profession, in the form of the disc business, the nerve business, and yes, even the knee business, in the form of Disc Centers of America, in the form of Neurodoc, Neuropathy Treatment Centers, and Knee Centers of America. These are the brands that we created. These are the brands that, believe it or not, that we actually give to all of our doctors for free. Yes, if you're part of our educational group, you ride this rocket ship like there's no tomorrow. There's never been a deeper Google penetration than any of these three brands in the chiropractic profession. Meaning when patients do searches for like, how do I avoid a back surgery? How do I avoid an epidural injection? What is Vicodin? What is Percocet? We populate 20 pages deep. And that is a statement. And it's a statement based upon a relentless pursuit to help all of you become a better version of yourselves. Dr. Kaplan and I wrote a book known as the Ultimate Spinal Decompression Book. It's over 800 pages. And yes, we wrote this book with the leader, the most published, the highest pedigree, the most respected neurosurgeon in the world in the realm of spinal disc disease and in the world of non-surgical spinal decompression. His name is Dr. Norman Shealy, MD, PhD, and the amount of content, tools, information, there's ways for you to actually get your hands on this content. I'll talk about it. Yeah, I'm going to talk about it on this live Zoom training, how you can get your hands on a lot of this content that actually comes from this book, and to get your hands on it like ASAP. If you're curious, and this is one question that I think is, doctors, that you need to ask yourself. It's a question Dr. Kaplan and I ask ourselves all the time. What is your why? I love when Dr. Kaplan asks doctors, what's your why? Why do you do this? And, you'll hear a lot of different answers. Oh, I want to provide for my family. Oh, I want to have freedom. Oh, I want to have independence. Oh, I want to have multiple streams of income. Oh, I want to have an affluent lifestyle. Guess what? Yes, I want to help as many patients as I can. Yes, I want to leave a legacy. Guess what? All of that is legit. And the reason it's legit is because it's your why. So if you want to know our why is simple and it's straightforward. You're looking at it. Both of our sons are in this business by choice. Both of them decided to become chiropractors by choice. And if you ask them why, they'll tell you exactly the same thing that I just mentioned to you. They like the freedom. They like the lifestyle. They love the respect of being a doctor. But the best part about it is they love helping their patients. The amount of testimonials that these two doctors get is off the hook, off the chart. And so Dr. Kaplan and I are in the trenches with you. This is something that was done 10 years ago, 20 years ago, 30 years ago. No disrespect to anybody else who who teaches anything out there, because everybody's got something to offer, right? But we're in real time here. We're in the moment. We are in real present time consciousness with you to show you, share with you, give you tools, information, content to help more patients avoid dangerous opioids, risky epidural injections, often unnecessary back surgeries, laminectomies, spinal fusions, metal in their back. Yeah, foraminotomies. Heck yeah. So, if I have one suggestion for you here, it's very simple. Whatever you can do to stay till the end of this Zoom meeting, because we're going to do something for you we've never, ever, ever done before. We've got a gift for you. It's going to blow your mind. We're going to blow your mind. But guess what? Before we give you the gift, and this is for only people on this Zoom meeting. Yeah, this is not shared with anybody else unless you're on this Zoom meeting. So you're in the right place at the right time. And, the coolest thing about it is that there will be at least one, maybe 5, maybe 10, maybe 20, maybe 30, maybe 50 plus doctors here that will take information and plug it into their office tomorrow morning from the information that they will learn here live, because we got all new stuff to show with you. Get ready. There is nobody better on the planet to share this information than who, Dr. Eric Kaplan. And nobody's got a better pedigree. Nobody's got a better resume. Nobody's got a better history. Nobody has a better attention to detail. Nobody's more relentless. I could talk about him all day, all night, and blow your minds. Blow your minds. But he loves this because he loves the results. He loves watching doctors win. He loves watching you win. And regardless of the table that you own or don't even own yet, You need the content that you're about to see. So whether you have an AccuSpine, a DRX, Hill, Doc, Kennedy, Spine Med, Triton DTS, they all have something to offer. And there's nobody on the planet that has something more to offer than you know who. So I'm going to come out of the slides for a sec because I just want to see his swag for tonight.
I love
I'm
these.
so excited. Yeah, do you love it? Did you love did you love the new hoodies and stuff?
I
What did
like
you
these
love the
because
most?
these are light.
Yeah, it's so cool. Well, guess what? I'm so excited to listen to what you have to say. So let's take it away.
You know, one time, I'm going to get serious for a couple minutes and deep, and then I'll get into my energy zone. Perry once put an acronym together for the word DISC, which means DISC is specialized chiropractic. And I think that's something that you have to understand the business that you're in. Now, as the former president, chief operating officer of Nutrisystem, I don't think anybody knows the weight loss business better than I do. I've spoken with Jack Nicklaus about it. I've spoken with Donald Trump about it. We know the weight loss business. And yet, many chiropractors, I'm questioning, what business are you in? I open up the American Chiropractor, right? And I like the American Chiropractor, especially when they review my articles. But it seems like, God, we could almost name this Invisired Chiropractic because chiropractors are struggling for income. And half this magazine now is Invisired and weight loss. Now, listen, I'm not against the weight loss business. But one of the things I got to tell you, doctors, is what you have to understand is return on investment. They did a study. Anybody who wants it to, I will send this to you, that the average chiropractor in the United States makes $78,000. Now, for our doctors, that's not acceptable. If I was ever in practice and made $78,000, I would do, what do they call it in Japanese? I would probably kill myself because you're not making money. And now that they want to study, there's another study I'll send anyone who wants it, that when a chiropractor, these kids graduate, they have $250,000 in debt. No bank is going to loan them money. So they have to go to work for inferior companies that do not understand the power of technology. Yet, Dr. Bart and I were honored to be contacted by Life University. We created Distance America Life University. Many people that are on this are founders. If you want to become a founder, we will eventually reopen that. But let me explain something. They deposited Monday $7,500 in one day. Now, you have to understand something. Why is that different? Because in this clinic, their outpatient clinic, they were losing $250,000 a year annually. When I came into Complete Wellness, they were losing $1 million a month. Now, you have to understand something, Doc. You have a choice, really. What business are you in? If I learned anything on Wall Street said, you have to know the business that you're in, the core business you're in. And let me tell you what it is. It's disc, it's nerve, it's muscle. Okay, weight loss, I will tell you, it'll be a fad because you're going to compete with the medications. The medications will eventually fail with all the side effects. The problem with weight loss is we've never been under control. You want to lose weight? Don't eat. Now, when you understand that, doctors, Invisired, and you pay $30,000, and then you have a lot of people buying wave machines, soft wave machines, $70,000, $80,000. Doctors, our doctors can get a soft shock for $20,000. Why? Because if you look at the statistics, if you look at the studies, it does the same thing. And that's what we're going to talk about, the specialty of chiropractic. We're going to talk about why an MRI is so important. We're going to talk about how you diagnose this disease. We just met with another professional golfer the other day. And we have to understand something. The D in doctor stands for detective. And the better detective you are, the better diagnosis you will give. The R stands for results. If you want referrals, you got to get results. And that's what it comes to. You see, you have to ask yourself, what price are you willing to pay to be successful? And listen, for those doctors that don't know me, if you want to get one of the best days of your life, okay, and if there's a client in the area, if I have room, Dr. Bard, get your butt into Chicago. Why? Because we never do that one day the same but you'll never walk away with more content. I mean, now we're in the process, besides the book on decompression, 800 pages, we did a book on neuropathy, 800 pages, CEUs. We will be doing, doctors, a CEU program in October at Life University on knees. We have professional athletes coming. We have orthopedic surgeons coming. We have many leaders in the world coming to this event. Now, let me explain something to you, doctors. The room only holds a few hundred people. We will have it at the university. Our clients will get first shot. So, if you're a client, great. I mean, why do we have clients making 1 million a year, 2 million a year, 3 million? We have a client, doctor, doing $600,000 to $700,000 a month. And the average chiropractor in America makes $78,000. And I'll tell you why. They don't know who they are. Are they a wellness center? Are they a weight loss center? Are they a functional medicine center? Doctors, spine is our specialty. Who knows more about backs than we do? Spinal decompression is made for modern chiropractor. It utilizes advanced technology. It addresses herniations and protrusions. Remember this, doctors, a subluxation becomes a bulge and a bulge becomes herniation. At the American Academy of Orthopedic Surgeons, all but one orthopedic surgeon would opt for back surgery. Tiger Woods has already had 7 back surgeries. My son and I met with a pro golfer yesterday, PGA professional, and he said, I don't want surgery. We worked with another one who went what he thought was non-invasive injections. Doctors, there's no such thing as a non-invasive injections. He ended up with a staph infection, and he hasn't played professional golf since. After they had to have surgery, after he had infusion, he went for non-invasive injections. We have to be the specialist. See, why is chiropractic alternative care? Alternative care should be surgery. Chiropractic first, drug second, surgery last. Subluxation first, bolt second. Now, when you understand that this is a new world of chiropractic, and if you go back to B.J. Palmer surrounded himself with many medical people. Now we're doing knees. We have people doing 1 and 2 knee cases per week. At Life University, with minimal training, he closed a knee case last week for $4,500. Now, you might say, well, that's not that much, doc, but watch this. If you did 1 knee case a month, that's $4,500. If you did 1 decompression case a month, that's $4,500. If you did 1 decompression case a month, $4,500. Even 4,000, 4, 8, 12. That's $12,000 a month. That's $144,000 a year. That's double what the average chiropractic makes. And if you're sitting there like saying, why me? And I'll tell you why. Get your ass to Chicago. Get your ass, if you're a doctor, to an upcoming boot camp. Oh, we don't even call them boot camp anymore. Dr. Bard put a super to the boot camp. It's now not a boot camp. It's a super boot camp. Why? Because we supersized our office. We have now rooms for beginning doctors. We have now rooms for advanced doctors. We now bring in a professional photographer to get you exclusive photo shots. We bring in a professional mediographer to do media. It is one of the best one-day trainings that you will ever be in and ever participate in. And I guarantee you, because you have to say to yourself, what's the value, doctors, of 1 new patient? I mean, you come to Chicago, or you come to a boot camp, or you come to an event. What's 1 new patient? If you come to any seminar I ever do and you don't get 1 new patient, give me a call, because I'll talk you through it, because it means that you stink at what you do. It means that you're not committed. It means that you're not focused. It means that you do not have your finger on the pulse. You do not know. There has never been a better time for chiropractic. Do you know that last year you had 80,000 failed back surgeries? 80,000. Julian Whitaker, MD, surgeon, said, when your only tool is the hammer, everybody looks like a nail. You see, people think that getting surgery is like getting a root canal. It's not. How do I know? Dr. Bart's son's a dentist. People think that having back surgery is like having an extraction, an implant. It's not. How do I know? Well, A, Dr. Bart's son is a dentist, one of his 2. And how do I know? I've had both. Nothing is more painful and complicated. And I shared the story, doctors. I'll send anybody, client or non-client, that's on this today. I will send you my MRI. I have 3 herniations. I have annular tears, and without decompression, without knowing what I know, I would have had back surgery. I would have. And my back went out so bad a month ago, that I couldn't even get in and out of bed. So what did I do? I called my son, and I went first 3 times a week, 3 times a week. Now I'm down to once a week. I hit golf balls today for an hour and a half. I mean, it's amazing. I get off the table every time and I say, Perry, you know what? This thing works. It really works. I can't believe the effect of spun. And people that don't know that, doctors, it's your fault. And that's why we provide lectures. That's why we dominate Facebook. We have more real estate on the internet than anybody. See, a subluxation becomes a bulge becomes a herniation, but doctors, all roads lead to disc. I mean, if you're not treating disc injuries, you're not diagnosing them properly. And I'm going to tell you why. See, many people say, oh, this is a chiropractic patient and this is a decompression patient. No, no, no. Think of yourself like a hospital. Everybody that comes into your office, they come in basically for spinal related reasons. For spinal related reasons. It's your job as the detective to make the right diagnosis, to determine if they have a subluxation, if they have a bulge, if they have herniation. And the treatment is separate and distinct. And I will review in Chicago at boot camp how you treat a subluxation differently from a bulge or a herniation. You see, because a bulge, protrusion, extrusion, sequestration, I mean, how do you handle it? MRIs, doctors, are not there to confuse you. What it's there to do is it educates you on the tissue. We know there are 5 components to a subluxation: kinesiopathology, myopathology, histopathology, neuropathology, and pathophysiology. We know that. Okay, but however, histopathology is tissue. Kinesiopathology is abnormal position of the bones. Well, if the bones get a little bit subluxated, doctors, then we know there's a chance by Chung Ha Su from the University of Colorado that pressure could be on the nerve and on the disc. Well, you see, with the disc, because we went up with a pro golfer the other day with my son, what happens is his L5 was now rubbing. We had early signs of stenosis. And people say, oh, can decompression treat stenosis? Of course it can. One of the things that we do in the big book, doctors, the big book, and I'll tell you, I have to lift weights every day and swim just so I can lift this big book. Okay, there's a whole area and a whole chapter on contraindications. I'm sorry. Thanks. So there's a whole thing on contraindications. When you're dealing with stenosis, and it's very funny. See, an MRI. So what is the difference between an X-ray, a CAT scan, and an MRI? Well, an X-ray will show you kinesiopathology, and it's primarily used for bones. But I know infections, lung. But we know that a CAT scan and an MRI is best. Now, one of the things that we do with all of our doctors is we work on getting a reduced cash rate. You see, doctors, but part of it is that we teach you at boot camp, and I will teach you in Chicago if you're there or boot camp, is how do you create the necessity? See, doctors, if you're not a good detective, well, if you go to them, well, maybe we need an MRI. I think you should get and they say, oh, no, that's too expensive. But you see, then you didn't explain to them the importance. You see, what I believe, doctors, is the old world of chiropractic has gone away in my book. It's no longer 3 times a week, twice a week, once a week for the rest of your life. That the 4-day report of findings, doctors, has killed this profession. You have to make a choice today, doctors. You want to be a doctor or you want to be a salesman. And let me tell you something, facts of life, 80% of my clients suck as salespeople. They suck at it. Me? Yeah, I agree. I'm a good salesman. Put me in the desert, I'll be adjusting camels within a week. They'll call me Dr. Camelhead. I will adjust camels all day long. I'll do whatever it takes. Why? Because I believe the power of kinesiology. I believe the power of my hands. I know that I can help people. You see, it's all willing down to you. And I break the acronym down to you is the bottom line is the Y stands for you're in charge. You're in charge of your success and you're in charge of your failure. The O, wow. The O means you got to get out of your comfort zone, doctors, because most people don't like to change. But let me tell you, what is one new patient worth to you? That's what you got to ask yourself. Are you doing these yet? If your answer is no, shame on you. Why? Let me tell you our objective, doctors, as chiropractors. We are the non-surgical solution. We are the chance and the choice that people should have prior to choosing surgery. We are the choice that people should have versus drugs. Perry will go through the drugs with neuropathy. We did a program on it. We brought in podiatrists, and it was very interesting because neurotonin, Lyrica, Neurotonin, okay, all these drugs, doctors, do not treat the cause. They treat symptoms. And the most effective, doctors, by research is Lyrica, which has a 50% success rate. But watch this. It also has a 50% failure rate. And if you look at the Weiss study, many times that people have sciatica, okay, it's due to neuropathy. So what does that mean, doctors? Sometimes your decompression cases can be neuropathy cases, and your neuropathy cases could be decompression cases. Well, is that worth more money to you? You bet. Common symptoms of a disc injury are back pain, okay, arm pain. But guess what? A common symptom of neuropathy could be sciatica. A common symptom of neuropathy could be weakness. A common symptom of neuropathy could be numbness and tingling and delayed reflexes. That's why it's on the right-hand side. So if you look the left side and the right side, there's a similarity. So you need to know how to test people for neuropathy. How do you learn that? Get your ass to a boot camp. Get your ass to Chicago if you're not there. We will show you what it takes to be a better doctor. You want to do weight loss? Oh, because let me tell you something. Let me tell you, the bottom line is this. We called it at Nutrisystem when I was the president, kissing the mirror. You know, they lose a little weight. It's a class 3 laser. Many of you have lasers. You don't need a more dramatic laser. You have it. I believe cryotherapy is actually better for weight loss with certain supplements. We have a supplement program. What they pay the $200. Listen, I was the president of Nutrisystem. We know what works with weight loss. You want to spend $30,000 for this, and then now you turn a page. The other thing is HydroWave. HydroWave is just another form of shockwave therapy. There's two types of shockwave, doctor, focused and unfocused. Okay? Focused are used for kidney stones. In the clinic, used unfocused. So you can do soft shock and other things for half the price. That's why we recommend laser. Lasers are magnet to blood. Okay? When you think about that, there are 80,000 failed surgeries per year. And contraindications, okay, which I talk about, everything that's FDR cleared goes through the CFR 21. That's the book that clears it. Now, in the big book, all of our doctors should have it. The big book, we have the over, it's on page 21. Okay, page 21. But however, what you need to do, doctors, is Perry showed earlier that there's different machines. You need to know the different machines. Your manufacturer will do it. Osteoporosis, what level of osteoporosis? Pause defect, what level? Okay, fusion, what level? But what I'm telling you, doctors, there's many ways that you can treat things, but you need to know the complications. And you need to get, and I'll tell you again why. Your manufacturer, doctor, has liability insurance. Did you know that? That many times, what if it's not your fault, doctor? What if they report? I don't want to break anybody's heart here, but there was a child that got killed with a Chattanooga table because he went under the table and there was no shutoff valve. You need to know these things. You need to know your table. You need to know, according to Norman Shealy, the top neurologist, MD, PhD, said, you shouldn't be using research on decompression if the research was not done on your table. Most of the machines out there do not have research that was done on their table, which is why we recommend certain tables. I want a table with a fixed tower. I want a table that can give me a graph. I want a table that almost does an oswestry every time. The importance of decompression as my son articulately explained to the pro golfer the other day, much more articulately than I could. And Richard Law used to call it, he'd say, it's like you have to milk the disc. You got to create the actual word is imbibition. What you got to do, if the disc consists, doctors, of 78% fluid minimum, what we want to do is rehydrate the disc. We have a pump failure. And when you rehydrate the disc, I mean, it's amazing. 86%, there it is water. So if we can rehydrate the disc and expand that space, doctors, expand that space a little bit. Oh my God, what a change you're going to see in the patients. I'm the perfect example. I can't believe how many golf balls I hit today. And I'll get a call from my son later. He'll yell at me for hitting that many golf balls today. But without Jason, I would not be able to do it. But here's what we learned. In the beginning, Jason said for the first 2 weeks, you do nothing. You see, you have to have the guts, doctors, to be a doctor. You can't be scared of rejection. Because if you're scared of rejection, you've already rejecting yourself. You have to tell the patient, listen, you're going to have to take it easy for the first week. You can't do this. You can't do that. You can't do this. Because otherwise, Jason told me of one patient, they were totally asymptomatic, and then they went home and they started like lifting stuff. Well, you can't do that. He's very exclusive that he says after decompression, don't do anything difficult for 10 hours. 10 hours. Because remember, what you're doing, doctors, is you're opening up the desk, you're opening up that disc space, you're putting pressure on it, and it doesn't open overnight. Why do braces take years? And you can't tell a patient it's going to take 6 to 8 to 10 weeks. There are your numbers. That's the average tissue time for muscle strain, tension injury, ligament injury, other tissue. I mean, you have to understand it's the histopathology, doctors, that takes time. And believe me, I go over all the studies. I go over the Shilley-Reloy study. I go over every single study, the Chaffel and Shaw study, the Boudreau study. I mean, the Ironman study, the Leslie study, the Kennedy Willis study, the Dio study, the Thornberry study. You have to know your studies, doctors. And you have to explain it. In the Leslie study, doctors, we give a handout. It shows the improvement over a 6 to 8 week period. You have to understand what a disc bulge means. And this is a great, for all of our clients that want this picture to add to their report of findings, email Dr. Bard, any of our clients that are on site, we will give this to you. The last two, go back to the last slide, Perry, please. If any of you want these two slides, I don't know if it's one of his special gifts tonight, but you know Dr. Bard, we call him Santa Bard. Email him and we will send you these two slides. Why? Because patients have to understand healing takes time. You know, listen, God bless Harvey Lillard and God bless D.D. Palmer. But guess what? You're not D.D. Palmer. And your patients aren't coming in with loss of hearing. They're coming in with disc problems. They're coming in with back problems. And it takes time. It just takes time. You know, the key points is a bulge is to diffuse, a protrusion is focal, the neck, okay? You have the paraspinal muscles. I mean, it's up to you, doctors. Remember, why? You're in charge. Oh, get out of your comfort zone. You understand the patient. And what you need to decide to do is how good you want to be at what you do. My goal in life was never to be average. Average was the best of the worst and the worst of the best. You know, according to the American government, okay, almost $14,000 is what an average back surgery would cost between that and the center. And we also know, doctors, on the second surgery, there's only a 35% success rate on a revision. Are you kidding me? The hood traction study showed that there's only a 50%, semi-success rate with traction. And that was first done by the Shilley-Bergmeyer study, isolated by the Ramos and Martin study, which showed negative disc pressure. That's why, doctors, why does an inversion work? Well, guess what? If you want the statistics on inversion and why it doesn't work from Harvard, Mayo Clinic, we'll give it to you. Why? Because inversion creates positive disc pressure. Go over a few things, PB.
Sure.
I had a cough.
Absolutely. So what we want you to do here, obviously, is we want you to obviously take a look and understand the difference. See, when you get an MRI report and it says bulge, it says protrusion, it says prolapse, it says sequestered disc. You have to be able to make a medical determination whether this patient is a candidate for non-surgical spinal decompression on a biomechanical level. Now, here's one of the cool things about it. Even patients that may not make the qualification or the criteria based upon a number of, as you might have seen, contraindications or possibly other disc material that is compromised to the point where they may not be a candidate. And this is, listen, whether you have an Acuspina, DRX, Spine Med, Hill table, Doc table, Kennedy table, every table does something a little bit different. Now, which tables do we like? Well, guess what? We're not in the table business. We're in the education business. But we do like tables that, number one, have higher statistical outcomes. Number two, have the ability to hydrate the disc better. Number three, are able to do this on a micro level. When I say a micro level, to be able to oscillate and or pump the disc. There's really only one table that does that, but that's for another Zoom meeting. What I'd love you to know and to see is that and this question comes up a lot, is an annular fissure an actual herniation? Well, the determination of a herniation often comes back to, as you know, the degree of involvement of the nucleus pulposus. So once the nucleus pulposus starts to intrude into the channel, that's why if you ever notice when Dr. Kaplan does not a report of findings, yeah, everybody else calls it a report of findings, we call it a case presentation, that you'll notice that he's very exacting with the utilization of specific models, biomechanical models, anatomical models. There are certain ones which we prefer. There are certain ones which we advise. They're inexpensive and so on and so forth. But the most important thing that I can tell you is that you really need to know the difference between, as you know, a herniation, a prolapse, a protrusion. You know where I learned a lot of this stuff? And I actually give the book away. I don't even have, obviously I don't even have it as a gift tonight, but for any of our family of doctors that want to reach out to me, you know what I'm talking about. There was a book that I got in 1985. It was called Managing Disorders of the Lumbar Spine, written by the great Dr. Paul Markey. Unfortunately, he's not around anymore. He was a disciple of Cox. That book is not even in print anymore. And what I do often, as you know, is I actually give that as a gift to our family of doctors. So if you don't have it, if you reach out to it, I'll send you my exact book to download, and you'll see all my like little scribbly handwriting in there from 1985. But he was the one who taught me exactly how to communicate it to the patient. He also talked about, before the Ramos and Martin study, the ability to create disc pressure. In other words, the Nachman study. Did I say it right, Dr. K?
Yeah, you did.
Did I?
You have to put a little. You have to put a little Jewish in it.
I know.
You got to put a little Jewish in it.
So I'm going to leave it at the Nachman study because
you got to put a little Jewish, like
because I love that study because it was based upon, there's a difference between sitting and standing. There's a difference between supine and prone. There was a difference between, one of the things that patients do when they go to the gym is they do a leg lift. Isn't it amazing that when patients do a leg lift, if they already have a predisposed disc problem, that's going to light them up. You're literally doing a straight leg raiser, a Lasag's test, live there, and they're coming into your office totally antalgic, totally with a minor sign. You know what a minor sign is. A minor sign is when a patient is an antalgic. That's your first orthopedic test that you could diagnose when they're in your reception area. Dr. K, take it away, brother.
One of the things, Perry, that the Bogdock and Burton studies showed was here's what you have to understand, doctors. This is so important, and everybody should write this down, because I think the patients will be impressed when you recognize the study. The Bogdock and Burton study said that by the time pain has arrived, the problem was already forming. Meaning it didn't happen in one day. It didn't happen overnight. This has been a progression of degeneration. No different if you ever get a cavity in your tooth. By the time you get pain, the cavity didn't form the night before. The cavity took months, maybe years. So when you can say to the patient, listen, you fall into the Bogdock and Burton. You see, one of the reasons that we did the thing at Life University is so our doctors that became founders can say, I'm one of the founders. And then let me tell you why that's important. I met with Dr. Sal Russo, who's one of the leading people for NCMIC. And one of the things that we study, Barry and I, with our sons, is why do people get sued for malpractice? Two of the reasons are, is disc and stroke. Why for disc, they don't diagnose it or they treat it improperly. And the first thing they're going to ask you is, where were you trained? Which is why you need to be nationally certified. So everything that we do, even when we do the knee, we're going to do knee and we'll throw decompression in there. So the certificate will say knee and spinal decompression. Why? The more hours you have. But here's what we've also done. And just so you know, doctors, people have asked me, what am I getting at Life University? I'll tell you what I'm getting. Two things: stress, grief. Okay. How much am I getting paid? Nothing. Nothing. Perry and I donate our time. But let me tell you why it's important. Life University now has the first elective course in a chiropractic school in decompression. Jason doesn't know this yet, but we're going to have to go up with me, him, Perry, and Devin, and the four of us will teach one of the classes. We'll do that. And I think that's something that down the road I can have other of our doctors do, to be guest speakers, to say you even taught it at the university. How powerful will that be? That's why we made this commitment. Oh, not only that, I taught this to the students at the university. That's why we bring them into the doctors. So you have to understand that. And then here's a young doctor. We brought, Perry and I raised between money and equipment over $450,000 for Life University. I mean, and why do we do this, doctors? Because this is our profession. And if we don't preserve it, it will go away. And let me tell you something. I'm not an anti-joint guy, but I wouldn't want my son working for the joint, because he has $250,000 in debt and can't get out of it. We need to create the business school of chiropractic. And that's the business that you're in. When I hear that the average chiropractor makes $78,000, I'm looking at Dr. Pridgeon. He makes that in a week, for God's sakes. Are you kidding me? LD, come on. You could be the richest guy in Georgia. If I was in Georgia now and they needed money, I'd come to you. Are you kidding? And then I see a guy, Perry, who happens to be on this webinar, Zoom, Calvin George. I don't know how many. When I look at Calvin George and Alvin Delgado, between the two of them, they're over 160 years old, right? They're both. Alan, shake your head. How old are you now? Over 80, right? I can read lips. How old are you? 84. And how old is Calvin? Calvin, how old are you now? Give me your fingers, Calvin. How many? 80 what? Do you have a bad thumb, or is that like 85? 80. And I admire, listen, what I love about the Delgados and the Georges of the world is they're still out there helping people. They're still out there. It's not about money. It's about your legacy. I don't do this for the money, not the crap that you guys pay me. Are you kidding me? I mean, what I do this for is I do this for my legacy. I do this for the profession. I want to make a difference. When I think of Dr. Delgado and Dr. George, just so you know, guys, you two are my heroes. I'm looking right now at the faces of two of my heroes who've given their life to a profession and have seen the changes in the profession. Hey, I know what it's like to see 250 people a day. I know what it's like. I got 3 herniations as a result of that. Listen, I did more side postures than side postures did postures. I mean, I did I did millions of $1 million roles. And it made me a lot of money. But what I'm telling you is the different world. But here's where it starts, doctors. I believe, and I talked to my son about this, we're in the touch business. I don't get caught up I don't get caught up with compliance. Yet, Vince Lombardi said, The name of the game is to win, fairly squarely by the rules to the win. I believe you need to examine every patient. I believe, I don't care if you do a 1-minute examination. I want to feel their back. I want to palpate them. I palpate everybody. Matter of fact, last night I palpated my wife, but that's a whole other story. I believe palpation is where all the good stuff begins. You have to touch the patient. And then once you touch the person, it creates a contact. There's an energy transmission that takes place right there. And then I could say, I could just feel their back. I do this all the time on the golf course. And I send back, oh, feel the back. Oh, doc, let me feel. And I just put my hand on the spine. And guess what you can feel? You can feel spasm. And if there's a spasm, I know there's a subluxation. My exam could be as simple as touching the person's back, touching their shoulders, touching their neck. I don't need them to do forward flexion. I don't need them to do extension. But I'll tell you what, I'll get them in the office. And then all I have to do is have an X-ray and MRI. But I'll tell you, if you don't touch them, you're not going to be as effective as if you touch them. I'll stake my life, my reputation on that. I believe that's where it begins. I mean, if you understand that 83% of all injuries, okay, are when the body moves into flexion. Flexion is the enemy, and you have to understand that, doctors. So my thing is, I can do that and just palpate their back, feel their back, have them lean to the left, lean to the right. That's all I do. Very simple. And then right there, I say, oh, you need some X-rays, you need an MRI, and they understand the need. And when we create the need, that follows what the Ironman study showed, because then you have to know how many visits do you need? Why does healing take time? Why does it take 6 to 8 weeks? Well, the Leslie study shows that. The Ironman study shows that. The Yoakum study shows that. The Boudreaux study shows that. And the Boudreaux study goes out even 4 years later. I mean, I want you to know that even studies have been done with Hopkins. I want you to know that when you know your material, so if you learned one thing today, I'm going to tell you when you see the person, say, ooh, we know it's been going on for a while. Why? Because the Bogdock and Burton study told us that by the time pain comes, the problem was already developing. And you have to say that with conviction, because those are the facts, doctors. You know, they think, oh, I bent wrong yesterday and that's why I have pain. No, you bent wrong yesterday. How many times have you taken a bite of something and then you got the pain in the tooth? Did that piece of candy cause the pain? Or was the cavity there and all of a sudden now it became aggravated? Right, Mark? You know what I'm saying. As you're chewing your piece of candy right now, you know exactly what I'm saying.
I'm so hungry when I watch a Zoom meeting. I don't know. Maybe it's Dr. Schultz. I don't know if it's what is that? What are you eating? Is that what Chef Boyardee? What is that? It looks like something out of a can. Oh no! It's a gourmet. Oh, it's chicken. See, if you say chicken, you'll be right. Like more than half the time. All right. So I want to show you guys something, because we got a lot more stuff that I want to show you. All right.
I want to say one more thing.
Sure.
I want you to understand, doctors, that the second most surgery done in America is spinal surgery. The second most surgery done in America is spinal surgery, with a 50% success rate. You want new patients? Start educating. Go ahead, PB.
So what I'd like to do with you is, if it's cool with everybody, is I want you to take like a 30-second breath.
Bo?
I get out of breath sometimes when Dr. Kaplan speaks, because, there's a lot. I don't know if you caught it, but he was throwing a lot of research studies out there that were consistent with the slides in the background, like sequestered disc, prolapse disc, protruded disc. Now, one of the things that I wanted you to pay attention to, which I think you caught, I don't know if you saw it on the slide. Tell me if you saw it. It came from Dr. Markey, and it's a word that Dr. Kaplan uses a lot. 3 letters, 1 word. You ready? I'll spell it for you. Y-E-T. Yet. Now, why is yet one of the most powerful words you can use in your consultation? Simple. Mrs. Jones, I know you came to our office and I read your paperwork, and I know you're having terrible back pain. And if it's okay with you, I always ask for approval. If it's okay with you, I'd like to ask you some very specific questions about that. But one of the things I have to ask you is, have you noticed a loss of bladder control yet? Have you noticed a loss of bowel control? These are touchy subjects, but you're doctors. So you got to ask. You get a free pass on asking tough questions. Yet, here's my favorite one. Have you noticed your legs starting to drag on the floor? Yet. Why is that important? Because those are the 3 criteria why somebody may need to be put in an ambulance and rushed out of your office to the emergency room to have another form of decompression, and that's surgical decompression. See, that nerve is potentially dying. Once there are those levels of symptoms. But remember before on the last slide, we said that we've got an incredible gift if you stay to the end. Well, guess what? We got some cool neuropathy stuff I want to show you, share with you. Dr. Kaplan's going to explain it. And there's one slide that, like, to me, if you don't get your camera out for this, shame on all of you. But guess what? There'll be a little code on it that'll say, take your phone out for it. But I wanted to show you something because there's 2 things I'm really bad at. Number one, I'm really bad at golf. I am. It's not like I haven't tried. I mean, he's given me 3 golf bags. He gave me one that was the exact copy of the president's. I own the exact bag that President Trump has with the golf clubs in it. Yeah, he gave it to me as a gift. Yeah. And I never really got that good at it. It's not like I haven't tried. So I'm really not that good at it. You know what I'm also not good at? I'm not good at keeping secrets. I'm not. So if it's okay with you, I'm just going to share the gift with you now, and then you can hang out to the end to get more stuff. So let's do it. All right. So if it's okay, let's see. Can you see that? Yeah, let's go. All right. So we wanted to do something incredible for you. And I don't know if you've been watching this whole time, but virtually every slide has a website on it. It's called Chicago Chiro Vent. There's a phone number on it. Write it down, 888-990-9660. There's a training that's coming up in less than 21 days. And the date is July 11th. So right, is my math right? July 11th. It's in the great city of the Windy City. We love Chicago. You might say, why? Dr. Kaplan loves the food. I do. But it's not about just the food. This is about a one-day training like you've never seen in your life. We've got materials, content, tools, information that we're going to put in your hand. It's over 1,000 pages. And this is, of all the things we do throughout the year, this is the training that everybody asks us the most about. And the reason why is I have a feeling it's because it's in the heartland, it's in middle America. That means people from California, Texas, Washington, North Carolina, South Carolina, Minnesota, Iowa, Louisiana, they all scoop up tickets for this stuff because they feel it's just Atlanta. It's just an easy way to get there, and they enjoy the city. But we're doing a special training on Saturday, July 11th, 2020. If you dig in some of these slides, wait till you see what's going on. Wait till you see what we're bringing that day. It's at a 5-star location. Many people say, well, gee, why don't you share the location? Because there's no walk-ups. There's when we bring a gift package for every single attendee. And because of security reasons, they turn people away unless they're on the actual security list, which we turn in 3 days ahead of time. And this time they're asking us to turn it in actually 2 weeks ahead of time. It's just not our policy. It's because of, fire rules or whatever. They can only have so many people in a room. It is what it is. But on Saturday, July 11th, this is the ultimate one-day entrepreneurial training where we will talk about decompression. We'll talk about this. We'll talk about social media. We'll talk about neuropathy. We'll talk about knee progress. We'll talk about personal injury. We'll talk about weight loss. We'll talk about ways to get your phone to ring off the hook. We'll talk about ways that most, if not all, chiropractors have no clue about in terms of creating a weightless practice. And like we said before, both of our sons are in this business, and there's a rumor going on that one of those sons is actually hopping on a plane to hang out with you in Chicago. Not saying who. This is a training like no other. Often doctors ask us, what's the best table? How do you do the cash programs the best way? What's the right amount of visits? All of this stuff we go over all of this. And if you're curious, this will be completely sold out if it's not already. We have an events team that handles this now. We had to kind of delegate this stuff to our events team because you know why. You can go to the website, Chicago Chiro Event, but you actually can't even register on the site. You have to call the phone number, 888-990-9660, to try to register a seat. It's actually the best $249 with a 100% money back guarantee that if you're not blown away, we'll give you your money back. Never happened before, but we're happy to give a guarantee. Yes, a 100% guarantee. It's $249.
Perry, tell them how much pages of material they will get.
Well, that's a great question because when I said 1,000 pages of material, it's not just 1,000 pages of material. You'll get manuals, you'll get jump drives, you'll get periodicals, you'll get books. See, all of that, there are things that we created specific for the Chicago Chiro Event that's never been shared, never been shown, never been given before, because this is a once-a-year thing. This is a once-a-year thing. So $249, best money you've ever spent in your life. In your life. But guess what? As incredible as that is, if you say you're going to give away the free gift of the year, then you got to stand up for it, right? You got to stand behind it. So we're going to do something we've never, ever done before. To all the doctors that are on this Zoom meeting with us right here, right now, if you want to come as our free guest, we will pay the $249 for you. And yes, you can still bring a free guest with you.
Hold on. Are you kidding me?
I know. It's nuts. But, you have this great thing about like Winston Churchill, and you can talk about that maybe after, because we're going to come back to it, because I want to do neuropathy stuff. I want to show neuropathy stuff because we're going to talk more about neuropathy. There's some great slides I need to share with you. You need to take pictures of this stuff right here, right now. But here's how it works, okay? Not all the seats are free. Now you might say, wait, hold on a second. What does that exactly mean? Because if you pick up a Chiro Economics, the last issue, if you pick up an American chiropractor, if you check your emails, every single doctor that registered for this paid $249 and happily do so. This is the only gift that we're giving, and we're doing it because you're on this Zoom meeting right now. Nobody else is going to see this. So they're all paying, what they should pay. And it's really, well, you could put a zero behind that. It's really worth, if you say, well, gee, what's it worth? To me, it's worth like $2,500. Meaning you'll walk away with $2,500 worth of content, tools, material, periodicals, and stuff. There's no contracts. There's nothing to sign. There's no pressure. You will fall in love with this. But here's the caveat. We only put aside a handful of free seats specific just for the people that are on this training. That's it. So I'll go back to it one more time. Write the phone number down. If you want the free seat, you can call right now. We don't need a credit card. They will not take a credit card from you. They'll take your name. They'll take your email address. I think they'll take your cell phone number, because if they update anything on the schedule, they like to have your cell phone number. But that's all they need. From you if you want to score a seat. You'll have a written confirmation, date, time, logistics, location. We start actually earlier. We actually start this program early. We had to move it up a half hour because of the amount of materials that we're bringing. And so write the phone number down. Free gift. Never done before. Probably will never be done again. You get to come to Chicago. And I got my phone on silent. I don't even know why my phone is ringing, but it's probably one of our team members that are calling me. So, I'm going to shut that down so everybody else can grab that phone call. Yes, I thought I did that already. 888-990-9660. Write this down. Grab your seats. This is only for you watching this right here, right now, and it's based upon seat availability. Dr. K, would you be so kind to talk about something that's pretty amazing here, because we wanted to talk about the disc nerve connection, and we've got some great content to share.
And I will, Perry. And you know, as I do that, and I say to everybody, remember a few things. Richard Branson said there are the three I's in business. There are the innovators, there are the imitators, and there are the idiots. And the idiots ruin it for everybody else. You know, what we're trying to do, doctors, is build the brand of chiropractic. When I was the president of Nutrisystem, nobody ever called up and said, how's the food? But yet with chiropractic or neuropathy, they don't know. The purpose of Chicago, doctors, is, you know, I'll go one step further. If you walk out of that seminar and you don't get a new patient, then you need to look into the mirror and saying, what didn't I understand? Because see, if you look at some of the studies with neuropathy, which I talked about, the congruence between neuropathy and decompression, if you look at the Feinberg study shows sciatica is common. If you looked at the Murphy study, which was done at the Mayo Clinic, you understand the power of balance. If you understand the Helen and the Berry and Viscosi study, again, you understand balance. And I will teach you a test that you can do in 30 seconds in your office. And I will teach that at the boot camp for those my doctors that are clients. I will teach that in Chicago. You need to understand the Barra, Binder, and Dickinson study at the American Journal of Pain Management, which says that back pain with radiation is a sign of neuropathy. And if a person has decompression, a disc problem, and neuropathy is worth more money, you bet. You see, when we do CEU seminars, doctors, we cannot talk money. But I will show you a diagnostic test that you can do in 30 seconds that can help you diagnose neuropathy. Chronic low back pain is recognized by the Schwartz study and the Feinberg study as a cause. And then cause of peripheral neuropathy in the feet, age, high blood pressure, high blood sugar, low levels of key vitamins. We know how important the B complex is, obesity, and people that are taking all these weight loss drugs, doctors, do you know the problems that they're having with the diminution of coenzyme Q10? We will talk about this. I know about this. Triggers, you know, striking global contrast, U.S. medications versus population. The U.S. makes up only 5% of the world population. This was actually produced by the Mayo Clinic. But U.S. consumes 75% of all the world medications. Why? We are a drug country. Our job, doctors, I'm going to challenge you tonight. My challenge to you is, hey, if someone in your area is having back surgery, you failed them. If someone in your area is taking neurotonin, serotonin, if they're taking Lyrica, you failed them. They don't know what you do. 22 million people suffer from neuropathy. 1 out of 5 people. That means tomorrow, doctors, if you see 10 people, 2 of them have neuropathy. If you see 20 people, 4 of them have neuropathy, and you didn't diagnose it. We will show you how. Let's balance test them. Let's do a 30-second test I can give you. We know that many medications that people take, that's why doctors, the D in doctors stands for detective. You need to know, here's one of my top questions. What drugs are you taking now? Are they taking cholesterol drugs, statin? Well, guess what? If you read my book, Awaken to Wellness Within, you understand that the body needs cholesterol. Cholesterol is the outer cell that protects the cell. You can't remove statins, and that's why we have a world of drug users and sickness and disease, and we can change it, doctors. This is a challenge. If you look at the James, the Starred, and the Weiss study, sciatic neuropathy is so common. Antibiotics, HIV drugs. See, doctor, so one of the questions you have to ask is, what drugs are you taking now? Oh, that could be a cause of neuropathy. You see, the more educated you are, doctors, to the problems, the more educated you become to solutions. You see, doctors, what do you want to be? The D in doctor stands for detective. The better detective you become, the better diagnostician. I want to do three things. I want to touch every person's spine because my hands are the greatest gift that God ever gave me. I want to I want to know what drugs they're taking. Why? Because I know that drugs are not the answer. They treat the symptoms and not the cause. I want the patients to know that I care. Research reveals that peripheral neuropathy can regenerate. But more than that, watch what I'm going to tell you, doctors. And I say this to every patient. Not only can nerves regenerate, the Boxell and Martin study shows that the disc has the ability to repair itself, but you have to create imbibition. And then that's why we look at the Dio study, and that's why we look at the Boudreau study, and that's why we look at the Pergolesi study. You need to know it so you can tell the patients. At the Washington study at Washington University is the Dio study. The Harvard study is Shealy and Bergmeyer. There are so many studies that you can produce. The smarter you become. So when Dr. Barnes said, for those of you not clients, that you can come to Chicago, you could do it at no charge. And he didn't tell you that, but it's in the Trump Hotel, which I think is the nicest property. It's on the Great Lakes. I mean, one of the things that in my age, doctors, I'm going to be honest with you, I don't want to travel if I don't love the city and I don't love the food. But being there, and I'm going to tell you what Perry said. Yes, my son will be there. And Jason and I had a talk. He said, "Dad, I'm in the I'm in the trenches every day." I think that's what makes Perry and I different as coaches and consultants. You know, we're not just on the phone. We're not just on emails. Our sons are in the trenches every day. Nothing makes Perry happier than when Devin has a good day. Nothing makes me happier than when Jason has a good day. So let me tell you what you have the ability to learn, doctors. We're trying to make money for our sons. And if we make money for our sons, we're making money for you. Half the things that you see that we provide, ads, advertisements, we use our sons as a beta site. We know what works. We know how it works. But now it's time for you to work it. You, remember what we broke it down? You're in charge of your life. The O, you get out of your comfort zone. You have to understand what it takes to be successful. Do you understand? It takes work. It takes focus. It takes commitment. Disc is decompression, especially chiropractic. The most incredible gift you could ever give is simple. And you know what? What stuns me, Perry? How many chiropractors are in America? 40,000, 50,000. I mean, how could I not have 20,000? I do this for free. I do this not because I have to. Doctors, so help me God, I don't have to work another day. Why are they not here? Every chiropractor in America should be here. But you know what they're going to do? They're going to look at the American chiropractor and they're going to spend 30,000 on Invisared when for $250 they can come to Chicago and I'll show you how to make 5,000 in one day. 255,000. You want to pay a $30,000 machine? Oh, I read this article. Hydrowave. Oh, it's only $80,000. What's your ROI, doctors? Your ROI at $250? The gift of the year. Are you kidding me? I'm mad at Perry right now. Stop giving this stuff away. I want them to pay to get paid. Nothing's for free in my life except for my love of my partner, the love of my family, and the love of my sons. So, doctors, here's what I'm saying to you from my heart. Are you meeting your potential? Are you happy with your practice? Are you getting the amount of new patients that you want? And if not, doctors, what are you going to do about it? Now, we've all heard if you do the same thing the same way, you get the same results. Doctors, it's 2026. It's a time of change. Perry talked about the New York Knicks. They were losing in every game. But you know what? They never gave up. Winston Churchill said, never give up, never give up, never give up. And you know what? Yes, there are some people on this call today, they're doing great. But there are some people on this call today are struggling. So I'm going to ask you why. The power of why. Why are you struggling? What are you not doing? and how can we help? Because I will tell you, there is a good world out there, and this is the best time ever for chiropractic. I look forward to seeing you at a boot camp if you're a client. I look forward to seeing you in Chicago if you're not. But I ask you to ask yourself this question tonight when you go home and you look in the mirror. And am I happy with my practice? And if you're not, you have two choices. Two, you can do the same thing the same way, stay at home, do whatever the hell you want. Or you can get on a plane, come to Florida if you're a client, come to Chicago if you're not a client, and say, what is one new patient worth to me? What if one day can make a 1 year difference? Because the Kabbalah says, live each day like it's your last, but one day it will be. You know, when they asked Jalen Brunson what his secret is, he said, I play every game like it's my last game. When you go to practice tomorrow, doctors, think about this could be your last day in practice ever. And how good do you want to be on that day? And how many people do you want to help? If it's me, I want to help them all. I want to help them more. You want to double your practice, doctors? Ask every patient to refer you one patient. If every patient refers you one patient, you've doubled your practice. I'm Dr. Eric Kaplan, hoping to see you soon and saying the future is in your hands.
The greatest motivation in the world, and I'm going to be very blunt. Blunt? Is that a right word? Blunt? Blunt. I'm going to be brusque and I'm going to be blunt. I think I made up a word. That's a Brooklyn thing. I think the greatest success in the world is your success. The greatest motivation is your success. When you have more income, more freedom, more independence, more affluence, more choices, that's what this is. That's what we teach. We give you tools, we give you content, we give you information, we give you strategies, we give you structure, we give you marketing, we give you a lot of stuff. Nobody gives more. But guess what? Reason we do that is because we live by the same credo. We underpromise, we overdeliver. If you took nothing away from this, and you only took this away, that your job, your responsibility, your sole purpose as a doctor, as a chiropractor, yeah, best profession in the world, if you know what you're doing, is to underpromise and overdeliver your patients, blow them away, wow them with materials, with packaging, with energy, but wow them with the ability to get results in your office. Create a 5-star dynamic in your practice from the moment they pick up the phone to the moment they walk through the door. And this is, as they say, the train is getting ready to leave the station right here, right now. Nobody will be able to attend this training based upon seat availability as our gift and as our guest, except for you watching this right now. You got the phone number, 888-990-9660. The countdown is on. I promise you, you'll never forget it. Do everything possible to grab a seat Saturday, July 11th, because guess what? You'll be blown away. We can't wait to see you there.